Hello everyone, my name is Sharma Mohit Kumar and today we will perform motor system examination of the upper and lower limb. As you as the motor system focus on body position, involuntary movement, characteristic of the muscle, bulk, tone and strength, and at last coordination.
Myself Sharma Mohit Kumar. I am second year medical student. How are you? Hi. Today I will perform motor system examination.
Observe the patient body position during movement and at rest. Abnormal position alert you to conditions such as mono or hemiparesis from stroke. Watch for involuntary movements such as tremor, tachycardia, or fasciculation. Note their location, quality, rate, rhythm, and amplitude, and their relation to posture, activity, fatigue, emotion, and other factors. Contour of muscle. Inspect the size and contour of muscles. Do the muscles look flat or concave, suggesting loss of muscles bulk from atrophy or wasting? If so, is the process unilateral or bilateral, proximal or distal? When inspecting for atrophy, pay particular attention to the hand, shoulder, thigh, and leg. The space between the metacarpal, where the dorsal interosseous muscles lie, should be full or only slightly depressed. The thinner and hypothinner eminence of the hand should be full and convex. Atrophy of the hand muscles occur in normal aging. Inspect for fasciculation in atrophic muscles. If absent, tap on the muscles with reflex hammer which stimulates them. Is relaxed voluntarily is maintain a slight residual tension known as muscle tone. This is best assessed by feeling the muscle's resistance to passive stretch. Persuade the patient to relax. Hold one hand with your hand while supporting the elbow. Flex and extend the patient finger, wrist and elbow and put the shoulder through a moderate range of motion. On each side, note muscle tone, the resistance offered to your movement. Tense patient may show increased resistance. With repeated practice, you will learn the feel of normal resistance. If you suspect decreased resistance, hold the forearm and shake the hand loosely back and forth. Normally, the hand moves back and forth freely but is not completely floppy. To assess muscle tone in the legs, support the patient thigh with one hand, grasp the foot with the other, and flex and extend the patient's knee and ankle on each side. Note the resistance to moving the limb. Normal strength varies widely, so your standard of normal should allow for factors like age, sex, and muscular training. The patient's dominant side is usually slightly stronger than the non-dominant side. Though differences can be hard to detect, keep this difference in mind as you compare sides. Test muscles strength by asking the patients to actively resist your movement. Remember that is muscles is strongest when shortest and weakest When longest, give the patient the advantage as you try to overcome the resistance and judge true of muscles true strength. Some patients give way during test of muscles strength due to pain, misunderstanding of the test, an effort to help the examiner conversion disorder or malingering. If the muscles are too weak to overcome resistance, test them against gravity alone or with gravity eliminated. With when the forearm rests in pronated position, for example, dorsiflexion at the wrist can be tested against gravity alone. When the forearm is midway between pronation and supination, extension at the wrist can be tested with gravity eliminated. Finally, if the patient fails to move the body part, observe or palpate for weak muscular contraction. Extension at the elbow by having the patient pull and push against your hand. Now responsible for elbow flexion C5 and C6, and now responsible for elbow extension C6, C7, C8. Test extension at the wrist by asking the patient to make a first and resist you press down. Ask the patient to squeeze two of your fingers as hard as possible and not let them go. To avoid getting hurt by strong grips, place your own middle finger on top of your index finger. Normally, it should be difficult for you to pull your fingers from the patient grip. Test both grips simultaneously with the patient arms extended or in the left to help compare the right hand grip with the left. Position the patient's hand with palm down and fingers spread. Instruct the patient to prevent you from moving any finger as you try to force them together. Ask the patient to touch the tip of the little finger with the thumb against your resistance. By placing your hand on the
Mm.
by placing your hand on the patient mid thigh and asking the patient to raise the leg against
रुको. Mm.
your hand firmly on the bed between the patient's knees. Ask the patient to bring both legs together. Medius and minimus. Place your hands firmly outside the patient's knee. Ask the patient to spread both legs against your hand. Gluteus medius and have the patient push the mid posterior thigh down against your hand. Support the knee in flexion and ask the patient to straighten the leg against your hand. The quadriceps is the strongest muscle in the body, so expect a forceful response. Position the patient's leg so that the knee is flexed with the foot resting on the bed. Tell the patient to keep the foot down as you try to straighten the leg. At the ankle by asking the patient to pull up and push down against your hand. Heel and toe walk. Also assess foot dorsiflexion and plantar flexion respectively.